three.
Hi, my name is Richard, and I'm here to talk about some oxygen therapy devices. We'd like to first start off with a nasal cannula, which is this device right over here. It's a low flow device. It has a flow range of 1/4 to 8 liters per minute. For children, infants, it goes down to 2 liters per minute. It has a flow range of 22 to 40 percent. It has an FiO2 stability variable. Um, the advantage to this device is low cost, disposable, can be used for just about any patient, adult, infants, and children. The disadvantage is it is uncomfortable, cause dryness, bleeding, and can be easily dislodged from its location. Best used for patients that are stable, that requires low to moderate FiO2, and for home care patients requiring long-term therapy. To show you about this device, we've got these two prongs curving downwards in most devices. You would need to place this curving down into the patient's nose to prevent irritation. Otherwise, it'll be pointing upwards, causing irritation to the patient. To place this on the patient, you would basically place the prongs downwards, place this over your ears, and over the ears, of course. And you would tighten this to fit. And that's basically how it attaches. To calculate the FiO2 for nasal cannula, there is not really an accurate way of doing this. So there is a rule of thumb which states that for every liter of flow, you would add 4% to the ambient air oxygen concentration. So we're looking at, for example, if we have 1 liter of flow, we would multiply that by 4%, which would equal to 4%, and you would add that to the 21% oxygen concentration, which will give us, if you add the two together, it will give you 25%. For 3 liters, you would basically multiply that by 4, which sums to 12. You would add that to 21%, it gets you to 33%. For 6 liters, you would multiply that by 4, and that gets you to 24%. Add that to 21%, it gets you 45%. For nasal cannula, for reservoir nasal cannulas, it's basically the same as the standard nasal cannula, except it would either have a pendant or a reservoir on the sides. This is basically it right over here. So two types, one with a pendant and the reservoirs, or either the reservoirs being on the sides, looking like a mustache. Essentially, the function is to trap oxygen for the patient to inhale. The flow rate on this is 1/4 to 4 liters per minute, and has an FiO2 range of 22 to 35%. It has a variable stability for FiO2. The advantage to this device is that it has lower oxygen usage, therefore lowers the cost, and it does allow for increased mobility for the patient. The disadvantage is it's unattractive, it's cumbersome, it creates poor compliance for the patient, and it has to be replaced regularly. For best use, we're looking at home care settings for ambulatory patients who needs increased mobility. For simple mask, which is this device right over here, it is also a low flow device. It has a 5 to 10 liters per minute flow. It has an FiO2 range of 35 to 50%, and it has a variable stability for FiO2. Its advantages to the device: it's easy, quick to apply, it's disposable. It can be used for just about any patient, including adults, children, and infants. The disadvantage is that it's uncomfortable. It must be removed when eating. It can be blocked by vomit, causing aspiration. For best use, it's usually for emergency use, short-term, moderate FiO2 uh, requirements, and it's for mouth breathing patients as well that requires moderate to low to moderate FiO2. For partial rebreathing mask, I'm sorry, show how to wear this device. You basically attach it to your chin after you attach it to the oxygen. Pull on the strap, put it over the head. You can adjust the fit with these two components right here, and that's basically it. Let's put the device. Move on to the next one, which is the partial rebreathing mask. It's also a low flow device. It has a minimum of 10 liters per minute flow, and provides an FiO2 range of 40 to 70%. It has a um, variable stability to it. In addition, 10% the flow requirement at 10 liters is to prevent the bag from collapsing. This is the reservoir bag where the oxygen flows into and where the patient would then draw their oxygen from. The advantages, it's similar to a simple mask. Uh, it's easy, it can be used for just about any patients, and it is for moderate to high FiO2. So disadvantage is that it's again similar to a simple mask. It's a potential suffocation hazards if the oxygen is somehow cut off. Um, for best use, again, is for emergency, short-term use, requiring moderate to high FiO2. To place this, to you wear this device, you would, once you attach it to your oxygen, um, press your finger against this port, allow the oxygen to flow in and fill the bag, and it would attach the same way as a simple mask does. Again, just put your chin over, put the strap over the head, behind the ears, adjust as needed. Um, a similar device is a non-rebreathing mask. Looks basically exactly like this one, except it would have the two ports will have two discs, and it will prevent outside air from being entrained in. It has a flow rate of a minimum of 10 liters per minute, and it will provide a higher FiO2 range of 60 to 80. Again, it has a variable stability FiO2. It attaches the same way, and to prevent the bag from collapsing, it does need a minimum of 10 liters per minute, otherwise it will not inflate. And again, it fits the same exact way. The advantages to this device is it's the same as a simple mask, but it does provide a higher FiO2 range. The disadvantage is again similar to a simple mask and a non-rebreather, partial rebreathing mask. It's a potential suffocation hazard. Best use is for emergencies, short-term use requiring high FiO2 range, and for patients just coming out of a fire that requires carbon dioxide buildup to be removed from the system. And we're following up to the AEM, or air entrainment device. This is a Venturi mask. It is a high flow device. The flow range for this is greater than 60 liters per minute. That's a FiO2 range of 24 to 50%. And it has, unlike the other device we talked about, it has a fixed FiO2 stability. The advantages is it's easy to apply, it's disposable, and it gives a precise FiO2. The disadvantages is it's limited to adults, it's uncomfortable, and there is noise involved, so it's noisy, and it must be removed for eating purposes. The best use is for patients that are in stable conditions who need precise low FiO2 range, FiO2. So talked about a little bit about this device. We of course have the mask, we have the corrugated tube, and we have this component which is the jet adapters. The jet adapters provides precise FiO2 according to a liter per minute that would be stated on here. So for instance, this nice pink one over here will provide 40% FiO2 at 8 liters per minute, and that tells you what to set the flow meter to. To assemble this, you would place this into here, and this would be the aerosol entrainment collar, which you would attach here. This will entrain air and provide the higher flow, and it would also be a protective device preventing blankets and stuff like that from causing the entrainment from being stopped and the patient not getting their FiO2 range. So we've got that, and to place this on is similar to other kind of mask. Chin, strap over the head behind the ears and adjust, and you can also pinch the color of the nose. And we're looking at now the trig collar and the face mask. So we'll start with the trig collar, which attaches to a large volume nebulizer. It has a flow range of 10 to 15 liters per minute with an output flow of 60 liters per minute. It has a fixed FiO2 stability, and it provides a FiO2 range of 28 to 100%. The advantage is it provides temperature control as well as extra humidification. The disadvantage to this device is that between 28 and 40% FiO2 is not insured. The FiO2 can vary from backflow pressure, and there's a high risk of infection. The best use is for patients with artificial airways, basically like this one right here with a trig collar, who needs low to moderate FiO2, especially for patients that have a tracheostomy. So to wear this device, especially with a tracheostomy, you simply, once it's attached to the components back of here, just simply place this over and have it rest where the collar is. It does not have to be fit tightly. A face mask would be very similar to the one. So a face tent, it's a high flow device. It's attached to a large volume nebulizer. It has an input of 10 to 15 liters per minute. It's a flow rate of about at least 60 liters per minute. It provides a 28 to 100% FiO2, and it has a fixed stability for the FiO2 as well. The advantage is it provides, similar to the trig collar, it provides temperature control, extra humidity. The disadvantage is that it does have a high infection rate. FiO2 between 20% and 40% is not insured. This device is best used for patients with intact upper airway, but who has burns around their oral area, and you don't want it to be in contact with anything. So essentially it would be against the chin like this and somewhat away from the face, and that's where the flow and the oxygen will go to the patient. So we're looking now at the blender, the O2 blender. It's a high flow device. It provides an output of at least 60 liters per minute. It can provide a range of between 21 to 100%. It has a fixed FiO2 stability. The advantage to this is it has a full range of FiO2. The disadvantage is it does require outlet that provides 50 psi of both air and oxygen. It can be inaccurate, and blender failure is a common occurrence. It's best used for patients with high minute ventilation who needs a high FiO2. Some examples are in care for neonates or in use of a non-rebreathing mask or close to delivery system. So if you look at this device, there is the knob which you can set the FiO2 range as you see fit. Um, Torque tubes would attach to either components, one for oxygen and one um, for air, medical air. Here is where you're going to be attaching to the wall, to the outlet, the oxygen and your FiO2, and they would blend together and create a high flow for the patient. Um, so that's the blender device, and I believe that's it. And thank you for listening.